Doing daily exercise is one of the best things we can do to reduce our risk for having cardiovascular disease and thinking about heart attacks and strokes. It can help take off your weight. It can help prevent diabetes. It can reduce your blood pressure. It can also affect your overall mood and in ways that is really hard to anticipate, but can reduce your stress levels and just overall help you to make healthy decisions and live a healthy life. When we talk about exercise, there are a few specific things we recommend. We suggest either 150 minutes of moderate activity or 75 minutes of vigorous activity a week. It sounds like a lot, but just 30 minutes of dancing 5 days a week is all you need to do to really start to make these changes. When we think about exercise, often what we're thinking about is how it can improve your weight. But the benefits to health are not just about the weight. It can help lower your blood pressure. For some people, it can really make changes, bringing that top number, that systolic blood pressure, bring that down 10 points, 15 points in some of my patients. That's enough to get you off of medication, in some cases off of 2 medications. We know that exercise can help reduce your cholesterol level. That's another way to not just get off of medications, but also prevent you from having a heart attack or a stroke later in your life. What we know with exercise is that it improves insulin resistance. And what that means is your body can handle blood sugar level. You may be able to get off diabetes medications or prevent yourself from ever getting on them. And finally, the exercise can really affect your mood, and that change in mood can have influences throughout your day, making little healthy choices throughout your daytime, improving your relationships with your loved ones. You'll find that as you do more activity and that mood change happens, all of a sudden, all the other choices you have to make may be a lot easier. One of my patients who I like to think about when it comes to exercise came in to see me about 150 pounds overweight. I told him sort of make these small little goals. He ran with it, and when he came back, I couldn't recognize him. He said, took my advice. He said, every week I just want to lose a pound, and he came back to me about 40 pounds down. Over the next year, he lost another 50 pounds. He looked like a whole new person. We were able to take him off of some of his blood pressure medications. We were able to take him off some of his diabetes medications. It was one of the biggest inspirations for me, and it's something I continue to turn to when I'm trying to struggle for myself and also giving advice to other patients. Building these good habits, making these small little choices can have incredible effects throughout the rest of your life.